A specialist ataxia centre is a clinic in an NHS hospital run by clinicians with expertise in ataxia. The main difference to an ataxia centre from visiting a general neurologist is that the neurologist at the ataxia centre has many years' experience and has seen a large number of patients with ataxia over the years. They are active in research, and it's a one-stop shop to seeing a number of different specialists. So you may be referred to another specialty with, once again, has gained experience in ataxia. There are 3 ataxia centres in the UK, and these have been accredited by Ataxia UK. So they have to follow a number of criteria that Ataxia UK has set in collaboration with patients. They are in London, Newcastle and Sheffield.
So in order to allow us to come to a diagnosis when we meet a patient with ataxia, we start with some preliminary blood tests looking at common things like vitamin deficiency, sensitivity to gluten and so forth. All patients have imaging using magnetic resonance imaging because it's a much better way of illustrating the brain and the cerebellum in particular than an ordinary CT scan. If the MRI scan gives us a clue as to the possible diagnosis, then great. Then you have to begin to think about other possibilities, more esoteric tests, which might be guided also by your history taking. So if the patient, for example, has a family history, you are working on the assumption you are dealing with a genetic ataxia. If there's no family history, then you'll be thinking more about degenerative ataxias, immune ataxias, and so forth. And then you instigate various research processes to try and look at possible treatments. And if we take the example, for example, of Friedreich's ataxia, there's now several studies looking at pharmacological agents in its treatment, and that will be true for a lot of the other genetic ataxias. There are certain types of ataxias that are amenable to treatment. For example, there is a particular type of genetic ataxia which is manifesting with deficiency in vitamin E, and administering vitamin E at high doses you can reverse to a certain degree the ataxia. QR is an interesting concept because, of course, what you need to do is to identify the cause early to be able to stop the irreversible process of losing cells from the cerebellum. So if you are faced with a patient who has had cerebellar ataxia for 10 years without a diagnosis and they are already significantly disabled, say wheelchair bound, then you are not going to achieve a cure there. What you will achieve if you find a cause that is treatable is to stabilize their condition and stop them from getting worse. Which is why it's so important to intervene as early as possible, as soon as the patient develops symptoms, because if you are dealing with a condition that is potentially reversible, you could achieve cure for those cases.
Patients who have attended the Ataxia centres have generally given us extremely positive feedback, and the patients are telling us that they really feel like they're understood because the neurologist is such an expert in the subject. The other benefit of Ataxia centres is that there are specialist ataxia nurses there, so they can provide support both at the clinic time but also in between clinic appointments, because typically patients would be seen once or twice a year only. So having this additional support, I think, is very beneficial. In order to get a referral to an ataxia centre, you need to get your GP or neurologist to refer you there. We know that there are only 3 ataxia centres throughout the whole of the UK, so it may be difficult for patients to go to one. In that case, some patients may be happy to carry on seeing their general neurologist. Alternatively, Ataxia UK also has a list of other neurologists who have an interest in ataxia, and there's about 25 spread around the UK. So you can contact Ataxia UK or go to the website for more information.